medicine is almost 90% based on history. So if you can't communicate with someone, you're really lost. And in the emergency room, you need to communicate quickly and really sort of understand what's going on with the patient rapidly. And to not speak their language, you just can't really get a good feel for what's going on, and then you don't know exactly how sick a patient is in some circumstances.
There's little doubt that cultural and language education is very important in the education of clinicians today in the United States. For example, if we were to rank countries by the number of Spanish speakers that dwell in them, the United States would be number 5 on this list.
El abdomen.
El abdomen.
El hígado.
El hígado.
La cabeza.
La cabeza.
El ojo.
El ojo.
El cuero cabelludo.
El cuero cabelludo.
My name is Philip Starr. I'm a neurosurgeon in San Francisco, and I was interested in improving my Spanish for professional reasons. I would use it really in 2 different areas. I cover emergencies when I'm on call nights and weekends. I cover our county hospital, San Francisco General Hospital, where probably about half of the patients we take care of are primarily Spanish speaking and often have families that are only Spanish speaking. And I'm tired of calling the interpreter when I'm on call there.
On several occasions, I've had my students go in with an excellent interpreter and interview a patient. I then have followed up and done an interview myself, and have been astounded to find on a number of times that the story that I received was significantly different than the story that the student received. I think this only underscores the importance of the physician's ability to talk directly to the patient. If you believe, as I do, that the formation of a therapeutic alliance is important in medicine, then it only follows that personal conversation is much better than conversation that happens through the intermediary of an interpreter.
Hi, my name is Kristen Kuo. I'm a second-year resident at Children's Hospital, Oakland, California, and I am very excited to be here as part of this Med Spanish program. We see a lot of Spanish-speaking only patients in our emergency room and also on the wards. So I'm hoping to gain a better understanding of the Spanish culture here and also a better grasp of the language.
My name is Haywood Hall. I'm an emergency physician. I was trained at the University of New Mexico. I was raised in Mexico, and I noticed a very strong need to train people in medical Spanish and found a great opportunity to do that here, and I developed this program to train people in medical Spanish and cultural literacy and to provide some clinically based international experience. We're a very unique part of the medical landscape here in Mexico. We work with the health ministry, we work in their hospitals, we work in the rural clinics, rural mobile health clinics, which they have. They have community-oriented primary care clinics. We work with the Red Cross in their ambulance pre-hospital system. We have access to the local medical school. We're involved in a variety of training programs for Mexicans in emergency medicine, so we have a very good access. In addition, we send people to private clinics, and we do a lot to pair people up to the right place.
My experience with Med Spanish has been very good in that it actually brings in important elements of the educational process of impacting behavior. Not only because it gives, again, the basic skills of understanding the meaning of words, but the context that people give to words.
There are many things that I will take away from my experience here that I will use as a resident and also as a pediatrician when I return back to the United States. For instance, some moms believe that if they are angry or are very emotional, then somehow their milk is not going to be good for their child, where in reality, breast milk is always superior to anything else that we would recommend. So it's things like this that we may not understand, and it was very helpful to have that perspective.
I felt like it really progressed, especially now coming back the second month. I think after the first month I spent here, I was definitely able to memorize and understand most of the questions I need to ask for a basic medical interview, and you know, as far as the different characteristics of pain, and then also past medical history, you know, past social history, that kind of thing. So I was able to get a good grasp of that on the initial month. But this month, again, because it's real easy to memorize the questions, but it's harder to understand the response. Of course, the patients don't always speak in present tense, and so that's why I felt it was important to come back this time and to gain a more firmer control of the other tenses, and to have a kind of a larger grasp of the language. I think this will definitely make me a better physician, because I understand more about the culture and where our Latino patients are coming from. With a better grasp of the language, we're able to communicate better and be able to get better histories and be able to treat them more appropriately.